Some products at a great price. It's got to be BCI Bath and Shower. That's 1-800-449-1387.
Chicago's Progressive Talk, WCPT 820, where facts matter.
Hey, I'm Tom, host of the Consumer Guide Car Stuff podcast. Join us Sundays at 1 p.m. as the editor.
Hi, everybody. Good to see you this morning. Thank you so much for being with me today. Thank you. I'm so glad we're with each other. How about that?
Expert analysis and occasionally a rougher takes on what's happening in the auto world. We'll try and entertain you and maybe...
there's a class action lawsuit filed that can include up to 2 million, thank you so much, Devin, Chicagoans over stop and frisk. So we're going to talk about that today. And should the...
Change the world, change the world, change the world. We can change the world, we can change the world, change the world.
This is the Santita Jackson Show.
War and hate to a place of love, it's not too late. Gotta save the children, we can't wait. Let's change the world.
Welcome to the Santita Jackson Show. Hope you had a great weekend. It is Monday, September 13th, 2021. Has 2021 passed quickly or what? Is it just me? I hope you had a great weekend, everybody. I'm Santita Jackson. It's the Santita Jackson Show, coming to you from the nation's largest progressive talk radio station, AM 950 radio in Minneapolis, St. Paul as well. And so I want to hear your voices today. I want you to call me or text me at 773-763-9278, 773-763-WCPT. If you want to text me, GWC Injury Lawyers gives you that opportunity. I want to hear your voices today. We've got a couple of things to talk about. Should the unvaccinated, the people who haven't gotten the shots, should they be denied medical treatment? Joy Behar from The View kind of floated that idea last week on The View. And it's now becoming a conversation. I heard it discussed on CNN. More and more people are talking about it. Do you agree with that? And where does that go? Do we not treat people who smoked if they have lung cancer? I mean, what about the morbidly obese? You just keep on going with this. It's like going down the rabbit hole. But those are my thoughts. I want to know what yours are. Where do you stand on that? And then there is a class action lawsuit filed against the city of Chicago, as well as the Chicago Police Department. 2 million people, right, over stop and frisk. More than 2 million people it has been counted stopped over stop and frisk. Like 2,000, 1.3 every hour, just 2,000. I mean, it's just the numbers are just startling. They're just startling. So I want to hear your thoughts about this class action lawsuit and how it would be taken through the courts. How does that work? I want to know what your thoughts are. And of course, we're going to have good news from, we'll see if we get Reverend Dr. Uri or if it will come from me, but you're going to get some good news today. But I want to give you all of my love today, and so glad that you are with me on this Monday morning. Everybody like and share. Joyce and Dave and Yolanda and Andre and everybody, please, please, please like and share. And if you want to hear the podcast of this show, please go to WCPT820.com/Santita and then you'll be able to hear you can go to all of the shows that we've ever done. And so, Memphis, Tennessee, I love Memphis. Love it, love it, love it. So let's get right to Santita Jackson Show and get into the show here. All right, everybody. Today in Chicago, we're going to have a high of 81 degrees, partly cloudy. Minneapolis, St. Paul, 76 degrees, scattered showers. The Twins will be playing the Yankees. The Cubs, well, they fell to the Giants. Giants 6, the Cubs 5. And the White Sox, though, were triumphant over the Red Sox 2-1. Guess what, everybody? Now we are in football season. This is one of those rare times of year where you could get the NFL, the NBA, and Major League Baseball kind of meeting for just a week or so. It's always fabulous, So, well, but in Chicago, we didn't get good news. The Bears 14, they fell to the Rams. The Rams 34, the Bears 14. And, well, didn't have such great news, but it was a tight game, everybody, yesterday up in Minneapolis. The Bengals bested the Vikings 27-24. Tropical storm Nicholas takes aim this week at Texas and Louisiana. Not only will it dump a lot of rain, according to the CNN report, but it could also strengthen significantly in the coming days. And reactions are continuing to roll in after President Biden announced new COVID-19 mandates last week for federal workers. And even Dr. Fauci floated the idea of having a vaccine mandate for air travel. What do you think about that, everybody? Call me at 773-763-9278, 773-763 WCPT. Consumer Brands Association, or trade group that represents big brands like Coca-Cola, Kellogg, and Campbell Soup, issued a letter with questions about the plan, like how to ensure proof of vaccination. Arkansas Governor Asa Hutchinson says he's worried the new mandates will harden resistance rather than convince people to get the shot. What do you think? 773-763 9278, 773-763 WCPT. House Democrats are expected to release a draft proposal for the $3.5 trillion budget package today. And Democrats are looking to raise taxes in the country's richest corporations to pay for it, according to the latest details, which could change before the draft is released. These new tax thresholds would only affect people making more than $400,000 a year and businesses with incomes in excess of $5 million. The California recall is tomorrow. Everybody is looking at it. Will Gavin Newsom, the current governor, will he emerge triumphant, or will Larry Elder, conservative firebrand, become California's first Black governor? What do you think about that, everybody? The gubernatorial recall in California is entering its final stretch. And all of the big Democrats are going out to try to help Gavin Newsom. Will it work, everybody? All registered voters in the state got a mail-in ballot. And of the millions of votes already cast, Democrats are outpacing their advantage in the blue state, everybody. And it is a majority-minority state. The recall in 2003, now California there are more people of color, and it is less Republican today than it was in 2003. Will that make a difference, everybody? You let me know. 773-WCPT, 773-763-9278. Well, we're still in the mourning period as we reflect 20 years after the 9/11 attacks in Shanksville, Pennsylvania, in Washington, D.C., at the Pentagon, and just across the bridge, actually, in Virginia, the Pentagon, and then, of course, New York City, the World Trade Center. The FBI released a newly declassified 16-page document related to logistical support provided to two of the Saudi hijackers in the lead up to the 9/11 terrorist attacks. The document describes the contacts the hijackers had with Saudi associates in the United States, but offers no evidence the Saudi government was complicit in the plot. What do you think about that, everybody? Is it important to you that you know more about how all of that happened 20 years ago? You let me know. 773-763-9278, or meet my morning stars on Santita Jackson and Friends. Santita Jackson and Friends, everybody. President Trump's White House chief of staff is a target of the Capitol attack records request. And as this is interesting news, the investigations of the U.S. drone attack that killed 10 Afghans the other week find no evidence of explosives in that vehicle. The last known missile launched by the United States during its 20-year war in Afghanistan occupation, the August 29 drone attack in a Kabul neighborhood that killed 10 civilians, was described by General Mark Milley as a righteous strike that targeted a parked vehicle suspected of holding explosives. Well, a pair of investigations were published on Friday revealed that, contrary to the Pentagon's claims, there were no bombs in the car. The men accused of suspicious behavior were engaged in peaceful activities related to the driver's job, and there were 8 additional defenseless victims in the vicinity of the sedan, destroyed by a missile fired after several hours of surveillance. Well, we've got Pastor Todd Yeary. He's going to give us some good news today. What's on your mind today, Pastor Yeary?
Hey, Santita, how are you?
Great hearing your voice.
Good to hear yours as well. Well, not a whole lot going on. Look, football season is here, so it's probably. I don't want to be sexist, but I know for a lot of men, it's our favorite time of year. Let's just say that.
No, now hold it. I love football. My father made me understand it. He said half the world. No, just so that you know, he just said half the world is male.
Yeah.
We're into football. I don't want you to be left out of the conversation. So I'm just adding that in.
Good. So I'm kind of in the middle. I'm still hopeful about tonight because the Ravens play tonight. I watched the Bears game, and I'm gonna leave that right there. So that's what's going on with me.
Good luck with that.
Yeah, you sit there and you watch, and you got friends over, and it's okay to take some ribbing, but when you have to take 4 quarters of it, it's just not good. But
Bless
anyway,
your heart.
I'll be ready for the rest of the week. So here we go. Hope everybody's well. Good morning, Chicago. Good morning, Twin Cities, Minneapolis, St. Paul. Hope everybody's well. Time to get up, time to get moving. Put your feet on the floor. Yep. Feel that cool towel coming back up through the bottom of your feet. Take a deep breath of life. You are alive. Time to get going. Time to get started. No need to wait. Don't put life on hold. Get that morning beverage going, that morning Joe, that tea, that water, lots of water. Yeah, that too. Let me talk to you this morning as we get started. Give you a little good news. I know this weekend was, for a lot of folks, Santita, a tough weekend because immediately we were thrown back in time to what was going on September 11th, 2001, how we remember those of us who were alive at that time, where we were, what we were doing, what was going on. We remember the highlights of the day and the day that started really, really beautiful, not a cloud in the sky, all of a sudden turned ugly. I had to go back and deal with this because I think it becomes an exemplar of how we have to be able to handle some of the most unthinkable things that might happen in life and keep on moving. And I begin there with this notion. What do you do when the day that starts out being masterfully beautiful turns ugly without warning? How do you keep on pressing when maybe the plans that you had, the expectations that you had set, don't come the way that you expected, and you still have to figure out how you're going to keep on pushing? I have to go there, and I give you this as an answer. Paul, in writing to a very young church in a province called Galatia, says this in chapter 6, verse 9. Don't stop doing good, but in due season you will reap if you think not. I want to encourage everybody, don't stop doing the good. Don't stop putting forth the best of who you are simply because you've had a setback, had a difficulty, had some challenges that may have come your way. Don't stop putting forth the best of who you are simply because it started looking like everything was going to fall in place, but all of a sudden it took a turn for the worse. And here's the reason. The most important issue in the remembrance of what happened 20 years ago is not just what happened on September 11th, but really what happened on September 12th and the days after. We didn't have time to get stuck. We didn't have time to sit there and focus on. We were in shock. Everybody remembers that sometimes life can be shocking. But here's the good news, Santita. Due season, I had to go back and look. I was wondering, what is due season? What do you do when something has thrown you for a loop and you don't know what you're going to do? You keep on doing good. Why? Because in due season, you're going to reap a harvest. What is due season? Due season is not on the calendar. I kept looking. I'm looking. Where is this thing called due season? And I went there. I looked at the word. And the word says it's personal. It's your personal season. It's your personal time. This drive about life, this commitment to getting the best out of it, even sometimes when things happen that you did not anticipate, it's got to be a personal drive. Why? Because in you is all of the evidence you will ever need that God does awesome things. When you go to the mirror this morning, I need you to look at your reflection. And when you look at the details, how masterfully you've been knit together to leave a mark on the world, your drive to change the world has to be personal. And when you take it personal, not because you're bitter, you'll be better because the thing that tried to take you out has only put you in a position to make a bigger mark on the world. So don't get stuck in the setback. Go on and stage your comeback and keep on winning because this thing is personal. That's it. That's all. Go live life, live big, live well, live intentionally. And remember, there's greatness in you. And that's the good news for the morning. We'll talk soon.
Amen to that. The pastor of the Douglas Memorial Community Church in Baltimore and Executive Vice President of Rainbow Push, Reverend Dr. Todd Yeary, Esquire, giving us the good news this morning. Keep on pushing, everybody. Your breakthrough is right there. You always stop just before it's about to happen. Darkest before the dawn. About that. Let's talk with Dr. Deborah Holden about what COVID-19 is. I think we've been talking about it so much that I don't even know if we have a working definition of what it is and what it does. So the difference between coronavirus and COVID-19, and then at the bottom of the hour, we'll be joined by Dr. Shanina Knighton. I want to hear what your thoughts are. Many people are beginning to propose that the unvaccinated not be denied medical treatment. What do you think about that? What do you think about that today? But first, a working definition of the coronavirus, or because we just use that, and COVID-19 specifically. And has it evolved? Is it now COVID-20 or 21, 22? I don't know. So, let's get brilliant epidemiologist, Associate Dean of Public Health at Michigan State University, Dr. Holden. What has us up in arms? What is the coronavirus? What is COVID-19?
Okay, great. That's a good question, and good morning. So I'm going to draw people back to, in a quick analogy, when we had the AIDS pandemic. AIDS is acquired immune deficiency syndrome. AIDS is the disease. That disease is caused by a virus called HIV, human immunodeficiency virus. So HIV is the virus that causes the disease of AIDS, right? So if you get HIV, there are some people who will have HIV and be asymptomatic or have very few symptoms or only have mild sort of upsets to the system, the outbreaks, if you will. And then there are other people who will have it, and it will really start to attack their immune system. They'll develop secondary conditions, certain types of rare cancer or things like that. Their T cell count will drop. Their white blood cell count will go up and then go down. And then we said when you get to a certain profile, you've gone from just being infected with the virus to actually having the disease. And people used to talk about it as full-blown AIDS. This is like lay terms, like people who have diabetes, they'll say you got sugar, right? They'll say you have full-blown AIDS. So that's an easy way for people to think about it. There's the virus and that causes the disease. HIV is the virus, AIDS is the disease. The virus that causes COVID-19 is called SARS-CoV-2. SARS is severe acute respiratory syndrome, coronavirus 2. And people will often call it the novel coronavirus, which just means it's new, right? But coronaviruses, the whole family of them, in fact, are not new. They've been in animal populations probably since the dawn of time or very close to it. And we first identified coronaviruses in humans. Doesn't mean that's the first time they showed up in humans. It's the first time we identified them in humans within the 60s. It's called the coronavirus because if you look at it under a microscope, it's this round molecule. Like you've all seen the picture, right? It looks like a ball with these little spikes coming off of it, right? If you look down in a microscope and you're looking at it in 1D, that ball just looks like a circle, right? Imagine if you were standing directly above a basketball and you look down at it. You might not be able to see the depth, but what you would see would be an object that was round. Well, if that basketball had spikes coming off of it in all 3D dimensions, it would look like it had like the spikes like on a crown or like a halo around it. And corona just means crown in Spanish. So under a microscope, it looks like a crown, which is why we call them coronaviruses. That is something that they all share. They've got that viral molecule, and then it's got these spikes or this halo that's all around it. So if you get the virus SARS-CoV-2 and you build up viral loads and that virus replicates in your body, you can develop the disease called COVID-19. Again, COVID-19, and that was a great question. Is it COVID-20 now? It's not. Once it's named, it's named. This
even the variant
will 100%. Yeah.
Okay.
The disease is named, right? And we know this too. You know, all viruses mutate. So same thing with HIV. There was no one strain of HIV. It's a different type of virus, so it doesn't mutate as much as fast. But there are different strains. This is why we call it genotyping or genomic sequencing. You could actually identify, if you knew someone's sex partners, who they got HIV from, because there will be similarities in the strain of HIV that they got. So you can actually genotype the same way we have a genetic code. Viruses have a genetic code. So even the mutations, the base of what is SARS-CoV-2 is the same. But, the little few changes that will happen along the molecule in different places, and now they're finding that they're, having these changes to even the spike protein, it's still the SARS-CoV-2 virus.
Okay.
And that is the virus that causes the disease COVID-19. And it will always be COVID-19. If a new SARS virus emerged, that might be called COVID-21 or something like that. But this particular virus will always be SARS-CoV-2. We will be typing the mutations, right? And I really caution against this naming them. And we have a terrible history of doing this in science. Typing them by country or giving them names that are related to regions or people, like the South African variant. And to me, that just really fuels very racist ideology. That, in science, we've got naming systems, like with hurricanes. The hurricanes are named by the letters in the alphabet, and they start from A and go to Z and then loop back around to A.
Absolutely.
So if we got Hurricane Apple, the next one might be Hurricane Betty. The next one might be Hurricane Charlie.
Yeah.
The next one might be Hurricane Deborah. We go like that. Same thing with these major mutations. We should be using scientific nomenclature to label these mutations.
Absolutely.
So that we're not. And mostly they are. They will tell you where the mutation is occurring, but then we'll name it. This is the alpha. This is the beta mutation. This is the, and then if you want to know more, the delta mutation has a mutation on this particular part of the genetic sequence.
Okay.
Right now they're talking about the mu variant, right? So for anybody who knows their Greek.
Yeah. Well, I've got to run to this break.
Beta gamma.
No. I've got to run to this break, but this is what we need to know. Vicki Wells said, "You're such an asset." The etymology of the word coronavirus is something I've never heard before. I mean, this has got us running. We don't even know what it is. Back in just a minute. I'm sorry, I was moving you off, but I'm on that clock. What I want you to do? I want you to just go to time.gov, look that up. We'll take you to the next clock so we can be on the same page, because I'm running up against the breaks with the other cities that I'm in. Okay, so and I don't want to do that.
Are you talking to me or your person?
You. No, it's okay. No, because when you hear my voice, that means I gotta get out. But I want you to go to time.
At one point, the guy was putting a little music on. It was like the little 30-second. Like when you heard the little music, it was like you got 30 seconds.
Yeah, but no, they have to just a little bit longer, because it gives you a chance to get out. Gives you a chance to get out. But even then, if you get this this little clock so that you can see it, and I will send you the link. I'll send you the link, and it's something you need when you're on TV anyway, because this is a clock that it's the international clock, and you need to know.
Yeah.
You need to know how that works. Thank you for that. But girl, please, in Europe they have forests, and in the rest of the world, where people of color live, we have jungles. You know what I'm saying?
Yeah.
You just go, really? Okay. I mean, I live with the jungle because it's lush and beautiful, but Tarzan is not in a forest. Robin Hood is. And Robin Hood's a thief. I mean, he was helping out the poor people, but you know what I'm saying? He was in a forest, and it was fabulous. Yeah, but he was stealing. He was stealing. So, but we're going to talk. I
Robin Hood, though.
How he was robbing. I never got it until I was older as a child, when I understood that, when I saw, oh my goodness, what they're doing is, it's Robin Hood. Okay. I read that story. I had all that stuff. So let me pull this. Stuff today. Move some of these papers over, girl. I've got like stacks and stacks, and I go through them so that I can see which ones I need to let go of. Do we have Dr. Knighton on?
Yep, send her through.
Okay, great.
Yes, I'm here. Good
Hi.
morning.
Good morning. We met yesterday. Well, Dr. speak with you.
Yes.
Oh, we had fun.
Yes, and Dr. Knight is on this.
Okay.
I need to know more. She's like traveling the dang on country, getting her exercise on with her girlfriend.
Absolutely. Hold on one second. They're hearing crackling this morning.
Yeah.
I sound a little hot myself. Devin, can you bring me down just a bit?
Okay.
Okay, thank
Try
you.
now.
Carol, let me know if you're still hearing crackling. Everybody, how is the sound? Let's bring it down just a little bit more, Devin.
Okay, better or
Okay.
worse?
Okay, let me know. Let me know, everybody. Let me know how it's sounding. Please let me know now. Okay, and if you all want to weigh in on this topic, let us know. Call us at 773-763-9278, 773-9278. What do you think about the question of the day is, should the unvaccinated be denied health care? It's becoming a big issue, everybody. And I want to know.
And people that are left-handed or people who have
Change the world. We can change the world. We can change the world. Change the world.
This is the Santita Jackson Show.
War and hate to a place of love. It's not too late. Gotta save the children. We can't wait. Let's change the world. I am breathing.
Hey, everybody. Welcome back to the Santita Jackson Show, WCPT 820, the nation's largest progressive talk radio station, and AM 950 radio, the voice of progressive Minnesota. I have a question for you today. Should those who are unvaccinated be denied health care? That is a question. Many of you watched The View. It was something, you saw Joy Behar get into a debate about it. And she didn't come out and say that they should be, that the unvaccinated should be denied health care. But she said, basically they have the option to get this and they're not. So, perhaps we should consider that. And there's an Alabama doctor, Jason Valentine, who's refusing to treat patients not vaccinated for COVID-19. So what do you think about that? I mean, he's refusing to give them treatment. Some people have suggested that. In fact, there was an editorial in one of the major American newspapers that, hey, I'm going to come out and say it. Do not give a hospital bed to the unvaccinated. What do you think about that? How does that work? Do we stop treating people who have lung cancer who've smoked? Do we stop treating the obese, the morbidly obese? If police arrive at a crime scene, you don't know who the perpetrator is, you don't know who the victim is. Do you then make a choice about who you treat? I mean, how does that work? The crackle is almost gone, Cheryl Woods. Let's bring it down just a little bit more. Devin Andrakis, brilliant board operator and burgeoning radio personality. And so let's just bring it down just a little bit more. So I want to know what you're thinking, everybody. I want to know what your thoughts are. I mean, and this happens, the backdrop is we're seeing more and more vaccine mandates. We're seeing the president issued some sweeping mandates last week. Interestingly enough, they don't apply to McDonald's because because McDonald's are owned and operated by, well, they're operated by individuals, and many of them don't have 100 employees. Interestingly enough, and so there are a lot of companies that are structured that way. And interestingly enough, his mandates do not apply to members of Congress and their staffs. They are exempt from the vaccine mandates. That's interesting. And so I just wanted to, I said, let me ask Dr. Deborah Holden, who is engaged, obviously public policy is her space. But we've got Dr. Shanina Knighton, who is a research scholar, of course, at Case Western Reserve University, infection preventionist, a registered nurse. She occupies a lot of different spaces like Dr. Deborah Holden does. And I want to hear your thoughts because this is something. I'm going to repeat the number 773 763 9278 773 763 9278. I'm going to post it right now. I want to hear what your thoughts are. How will this work? Should the unvaccinated be denied medical care? What do you think? 9278. Dr. Deborah Holden, you are our policy wonk in the health space. You epidemiologist, you. What do you think about that?
Well, the very basics of good policy, right, is good policy is written, right? It's not implied. It's not a practice. It's written, and it's enforceable. It should also be fair and equitable. So the issue is, and I've been warning against this, vaccine mandates for teachers, I don't feel like are appropriate if it's only for teachers. Why? And do I think ultimately where we're headed is mandates? Yes. But I fundamentally believe it will have to be universal. There's cherry picking. So if you only mandate vaccinations for teachers and not for correctional officers, you mandated it for one group of people to protect the vulnerable population. It just so happens that women are overrepresented in the teaching profession. Men are overrepresented in correctional officers. Have we created a disparity in who is being forced to get vaccinated by gender? I think we have. It's so strange to me. Large employers and certain federal employees are going to fall under these vaccine mandates, but not Congress. Correct me if I'm wrong, but aren't there 100 senators?
Well, 435 members of the lower house, but three branches of government. President Biden's order on federal workers applies to the executive branch, but the House of Representatives and the U.S. Senate, that's in the legislative branch. So these are two different branches of government, but it is uneven.
So here's what's really interesting, though. Here's what's really interesting to me. The question is, what's the logic behind any of it? You understand what I mean? It's like this whole notion, and I keep saying it, and I know this, and I accept it, which is why I'm going to just stay the course with my work. Equity is just a weak muscle for our nation. It is a very weak muscle. Our nation was not designed to be equitable. It just wasn't. It wasn't designed for women to have the same rights, opportunities, privileges, access as men. It wasn't designed for people of African heritage and former slaves to have the descendants of former slaves to have the same level of access and opportunity and privilege and all that. The way things are set up now, there's not same opportunities for people who live in rural communities or people who don't come from legacy wealth or like the way our very society is set up. It was not set up with equity in mind. Equity not only is not baked in, it was intentionally left out. So now we're trying to figure out how to get it in. Okay? So from a public health perspective, we want things where it is effortless on the part of the person. right? I always use the example of fluoride in the drinking water. We were able to reduce dental caries and cavities and all kinds of, things that come from that. People don't even remember the day when people would die from a bad tooth, but that was how it was at one point in time. And this one public health intervention, fluoride in drinking water, made a profound difference in that phenomenon. Vaccinations, we had so many mandatory vaccinations. If you talk to people who are in the military, they will tell you, they barely had any idea of what they were being injected with when they would go to do their service. They just were told, you got to show up here this day and time. Something got injected in their arms. They went on about their merry way, and they dealt with whatever they dealt with, and that's how that went. Most of the time when we get our kids vaccinated, no one's asking what's in those vaccines. You just know you want your kid to be able to go to school, so you get them vaccinated. I do believe in, 40, 50 years, my granddaughter is going to look back and she's going to be learning about what happened during the COVID-19 pandemic, and they're just going to wonder why we fumbled it so bad. They're going to say, boy, they really did a bad job with that one. Look, they'll talk about the flu pandemic of the early 1900s. They'll talk about COVID-19. They'll talk about what we did with the HIV epidemic, and they'll say, man, they just really fumbled that. My grandmama was one of those public health people where they really fumbled that. So I think we're heading towards mandates, but this cherry picking, who is going to be required and who isn't, I think that's a problem. It's only going to further the divide. It's going to make more people dig their heels in, and it's going to give way, I believe, to a lot of litigation because it's not fair and equitable who they're saying has to get it and who doesn't have to get it.
Dr. Knight, it's very uneven in some of the most heavily vaccinated countries or countries that have the shot. I mean, I have a problem using the term vaccination because vaccination has a different meaning to us lay people, not to you, Dr. Holden, but, to lay people. We think when we hear vaccination, we think inoculation and I don't have to worry about it anymore. I really don't. I'm trying to figure out why I need to wear masks and all of that. That's where those discussions come in. But I want to know some of the most heavily vaccinated countries on earth are having a rash of breakthrough viruses. In fact, most people who are hospitalized have in Israel, they're having breakthrough viruses. So there's that. Then you see some people who are getting mandates and other people who are not getting mandates. I mean, if it's an airborne virus and an airborne disease and we're trying to quell it, then you apply it to everyone. But that's not what's happening. How will this work out? Because now we're having there's a hospital that is they're not going to be able to deliver babies because of these mandates. You have nurses who are resigning. I mean, you have workers who are resigning all over the country. Our police officers all over the country are pushing back against this. Your thoughts?
So I first and foremost want to touch upon the first topic that you mentioned in regards to breakthroughs everywhere else, and how there are this thing about breakthrough viruses. I have to remind people that we already have had I would say, different. We were defining COVID different, our country versus other countries. We were defining who needed a test different, our country versus other countries. We've had studies showing, hey, did we give the second dose too early? Should we have waited a little bit? Were we too progressive with giving the doses like right behind each other? Should they have been spaced out? With these other countries, we're not sure if they were testing while they were giving vaccines. We don't know what was happening in regards to why viruses were breaking through and why they are breaking through. But the one thing that I'm adamant about that I'm going to continue to stand with is that we have to remember that this is not an FDA-approved product. And on any emergency use authorization, on any fact sheet that you will get for any of the vaccines, they are very clear on telling you that it is not something that is approved, but that because there are no other solutions out there at this time, this is what seems to be the best. So the problem is with us even thinking about putting something in place to where we can say that people should be without health care. I think it's unfair until we have data. We have to remember that it was just as of December of last year that we were starting to administer the vaccines openly to the public after doing trials. Now that we're continuing those trials and we're trying to understand in not ideal conditions, but real life situations, how effective the vaccine is, we have to truly understand that right now we're still learning, and we're learning as we go. So my concern is we're starting to think about breakthrough viruses, which I'll be honest, I'm not sure if they're breakthrough anymore because CDC is telling us that it's only 0.1%, but I don't know why everybody I know somebody or they are somebody that actually got vaccinated and still had symptoms after the fact. Now, what I had to remind
one in a
them
million?
is that yes, but that's the thing. If they're defining breakthrough as having any symptoms opposed to having a reduction in clinically relevant symptoms or death, then of course, maybe everybody is breaking through. But I think we have to be very cautious in terms of how we're using those terms. And so right now, that is what concerns me is in regards to how are we defining it. And when it comes down to us thinking about even mandate, thinking about like healthcare workers, thinking about police officers, I have to remind people, put yourself in their shoes early on in this pandemic when they didn't even know what SARS-CoV-2 or know what COVID-19 was or know how to even protect themselves or even talk about the fact that we had shortages of PPE with no public health training in infection prevention for people that were told that they had to deal with the public because they were essential workers and could not stay home, that have had to put their lives on the line, that have had to take COVID-19 back to their loved ones, that have had to watch, actually they couldn't watch their loved ones die because their loved ones was inside of healthcare facilities that had restricted visitors. So some of us, while we are out taking care of the public, still have individuals that we can't even protect in our very own family because we're too busy protecting the public. So it is a tough situation to even think about, and a catch-22 when you hear a doctor say, oh, well, I don't want to treat unvaccinated patients, when we also have to remember that a lot of these individuals have different ways of life. Maybe they've been healing themselves and haven't relied on the U.S. healthcare system because we are, again, dead first when it comes to most the most expensive, but dead last when it comes to the quality of healthcare.
Well,
so there are people that have relied on other methods, and I think we should also acknowledge that and respect them for that because these are individuals that unless there has been an emergency, they haven't had to rely on the system.
Well, now, why do you think that that's important? Hold on one second, because there are a lot of people who've done that, and traditionally, marginalized communities have had to rely on, not on a doctor, but on a midwife. Just why is that important in the 21st century to acknowledge that?
It's important because we should acknowledge that a lot of, like, let's say vitamins, holistic things are not FDA approved, but yet people have created a way of life, with living with these things where they'll rely on herbs, they'll rely on oils, they'll rely on, different fruits and vegetables in order for them to be able to maintain their health and their immune system, opposed to relying on drugs. And I think that when individuals say that they don't want to be vaccinated because they've created this way of life to be able to keep themselves healthy, I don't think that that's something that they should be shunned for because they may need the healthcare system every once in a while. The other piece of that is very disheartening is that our taxpayer dollars pay into this very system, okay, that regardless of your status is told that it's going to protect you. I've had to take care of patients that had diabetes that I've educated them multiple times. They come in 1 week and it's an ulcer on their toe. Then they come in a little while later and now we got to amputate all of their toes. Then they come in maybe some months later and now I got to amputate their ankle, then a below the knee amputation, and then a above the knee amputation, because regardless of how much information I provided about diet, regardless of how much information I shared with them in regards to their taking their medicine on time and other things that they needed to do as far as exercise, they still chose that road. But that didn't mean that me as a nurse, I neglected taking care of a patient because they didn't choose to do healthcare the way that I thought that they should. We have to acknowledge that there are a lot of things going on in people's families right now. I have a relative. I'm not an anti-vaxxer, but I had a relative that, I kid you not, when he went in for his vaccines when he was a child, that baby coded 3 times, and the healthcare system ended up paying his paying his family or paying his mom and his dad. And that ended up with some detrimental effects. And so if you can imagine, that mother's not going to be ready to get her son vaccinated. And what am I going to look at her and say? Like, oh, no, well, this is actually the one right here. So I think we have to acknowledge that not every one of us has the same story, but we have to share the fact that literally when we pick and choose who gets health care and who doesn't, then just as Dr. Deb says, it continues to take us down the racial divide, as well as the haves and the have-not divide, which is where we've already been, and it's just continuing to agitate the situation even more. Because let's be honest, what happens when you come in and you can't find your vaccination card, right? But you in there receiving care and you telling the doctor that you received your vaccine, but because of the color of your skin, they don't believe you. So now you can't even get adequate care. So what's unfortunate to me is I feel that when I'm looking at, unfortunately, and I'm not saying this about all white people because, yes, I have white people in my family and I love them dearly. But there are some individuals that I really feel like need to check their privilege when they get on large platforms and decide to say, oh, well, we just not going to treat this certain population, or we're not going to treat the unvaccinated. Because when you look at the population of people that they're treating in their areas, do they look like them or do they look like me?
Dr. Deb, I mean, she's going right to the heart of your, one of just really part of why you do what you do. Equity. I mean, and I'm wondering also how this is going to play out. There's a New York State hospital, Lewis County General Hospital in Lowville, in upstate New York, that will temporarily stop delivering babies after September 24th because so many staffers, so many nurses, maternity unit nurses, and staffers have quit. They've resigned because they're undecided about getting the shots, or they absolutely don't like it, because some of the most vaccine hesitant have been in the healthcare space. I mean, how is this supposed to work? Because these rural hospitals, as you just mentioned, and rural communities have less access to equal high quality healthcare than those of us who live in urban areas or wealthy areas, and on and on and on. How will this play itself out?
Well, we're going to see more of this. But I like the point that Dr. Knighton was making also, which is, and I've said this, I just don't think we've done a good enough job with this rollout. It is so strange to me because this time, earlier in the year, I was fighting because there were so many people who were eligible who just couldn't get off of the maze of the wait list. Mm-hmm. So many elderly, so many of our elder loved ones, or people who were really sick, or people who were, in these congregate care facilities, et cetera. And there was no seeming, we've got to get these shots in the arm. Even the woman who was on the Biden task force was like, well, you guys are overemphasizing equity. The reality of it is we just need to get it into everybody's arms. And as long as we do that, like, what's the big problem? So it doesn't quite jive now that when we were really trying to prioritize and get the shots in the arms of the people who we said were most at risk for bad outcome, who needed to be first in line. We did not bring nearly the zeal that we have right now to trying to force it into everybody's arms that we brought back then. We just weren't doing it, and so now I can understand for a lot of people, they're like, nah, I'm good. Like, I get it. And the other thing that we're not acknowledging, and this is like Deborah Furholden. I'm a public health professional. I'll never be able to take that out of who I am. That's like down in my bone marrow now. But I'm also a human being. I do know a lot of people who did not have a great experience with the vaccination. A few people with some autoimmune issues that, their systems went out of whack. I don't know anybody who had the major blood clots or, any of those other things, but I do know some people who it didn't go so well for them. Mm-hmm. And I do know now a fair number of breakthrough cases. And I maintain most of those breakthrough cases have said, I told you I have a friend here. She runs a local newspaper. She's the founding editor of this paper. Her daughter went back to school and brought COVID home to her entire household, which includes her and her mother, who's 25 years her senior. My friend almost lost her life. Her mother was severely fatigued and kind of down for about 3 or 4 days. And she ended up being hospitalized, and now it looks like has long-haul symptoms. So I do think that there's benefit for the vaccine, but I just don't think we've done a good enough job that we're at the point where we can be forcing it in people's arms. The other thing that makes absolutely no sense to me, no sense at all, why are we moving toward these nationally regulated vaccine mandates when we couldn't even get a national mask mandate? That makes no sense to me.
It's uneven.
The harm or the risk
It's
of
uneven.
a mask versus getting an injection. So you didn't drop the ball.
Yeah.
The administration has completely dropped the ball on this very basic public health strategy, a mask mandate, distancing requirements, and occupancy requirements. And then we'll throw Dr. Knight in. They should have had OSHA, Occupational Safety and Health Administration, should have put in federal standards for workplaces and schools and public places, but they didn't do that. This is the stuff that wouldn't have been as expensive. It would have been smarter investments because we would have been creating safer environments post-COVID. This would create better environments post-COVID if all schools had standards around air handling and air movement and classroom size and spacing and all of that. And the $1.9 trillion that just got rolled out, most of that stuff was missed. Some of the districts that could jump to the front of the line, they got some of that money. They've done some of that. But that's where we needed national mandates, not on what people got to put in their bodies. I'm with a lot of people on this. I feel like the public health person in me knows it's ultimately where we need to be headed. But I don't think as a nation we've done the work. We haven't honored people. And I believe it's not going to stick. It's like doing the most too late.
Everybody, what do you think? I want you to continue to weigh in throughout the day because this is the world that we're in. Dr. Fauci now is saying that, at least he mentioned yesterday, that, hey, vaccine mandates for air travel. I just see, unless we have an even policy where, and not only you have these mandates, okay, Americans don't do that well, but okay, I get it. You got to be able to. Are you going to make America cleaner? What about the air that we breathe? Are we going to have? Are we going to really, really make it easier for people to be hygienic? I mean, what about the water that's not running in a lot of places? There are a lot of places in the United States that are unincorporated where people don't have running water. People are still using outhouses in the United States today. Think about that. Think about that. And think about this, because it is a discussion that we're going to be having more and more of. Let's talk about this new class action lawsuit. 2 million Chicagoans are part of it. Stopped a period of some years. Unbelievable. And it happened all the time. Like all the time. What do you think about that? 2 million people? Ooh. How is that going to work? Back with more of the Santita Jackson Show in just a few minutes. Dr. Deb, you all are brilliant. Thank you for that. You're saying
Well, it's just so crazy, right? We didn't jump all the way to vaccine mandates and never even had a mask mandate. Never had occupational safety mandates. Never did a mandate on the basic things that would have had us be better and stronger post-COVID.
Well, they never even had a mandate.
That's not even going to solve a problem. It's going to provide some help for one problem.
Look, let me tell you something. Give me a mandate on health care. How about that? Mandate it that everybody has equal access to equal high-quality health care. That's what you all need to be putting out there right now. If you can find me to give me a shot that the American government paid the pharmaceutical companies to develop and produce, and they get all the money, you can figure out access to equal high quality health care for every person in the United States of America. And I didn't say Americans, I said everyone here. Because if I go to England right now and I get sick, guess what? They're going to take care of me. No problem. Because guess what? If I'm sick, I can infect another person. So you know what? I might as well I better get her well so we can all be well. How about that?
But you got to teach the public, though. And that's my concern is that COVID ain't the only infectious disease that's around. So you are not teaching people the fundamental principles that only 3 to 6% of people clean their hands correctly and that we need to start there. If we are not mandating that companies continue their environmental cleaning, knowing that hundreds and thousands of people are going to be touching the same touch screens and surfaces within these facilities, they're not mandating any of those things. The stuff that high touch surfaces have a good chance of giving us COVID. But instead, y'all want to say like, oh, well, let's stop the severity of you getting COVID. Let's show us how not to get it.
How about that?
Let's show us how not to get the next infectious
How about
disease.
that?
So
Stay right there.
With all of this stuff is just backwards.
Stay right there because I'm going to have to let you all go in a hot second, but I want to get Paula through because she wants to ask a question, but I need to get you all off literally in a minute. Paula, what's on your mind, sweetie? Paula?
Yes.
Hey, sweetie, how are you?
Very well, thank you.
What's on your mind? Right here.
Oh, I wanted to ask Dr. Verholden if she thinks that the Delta variant is here to stay for a while, and the one that's backing it up, the Lambda virus, they say that that's going to fizzle out and not be as potent as the Delta variant. Does she see this happening too? Dr. Verholden, I wanted to ask you if you think that the Lambda virus will indeed fizzle out and not be as potent. Yeah. I'm reiterating everything I'm saying. I'm a little nervous.
No, don't be nervous. Just stay right there. But I literally, Deb, I've got because I need those 2 lines that you all are on. But go on.
It's a great question, Paula, and nobody really knows the answer yet. I can tell you we're already now talking about the mu variant. These are questions that we're going to have to learn about in real time. Delta seems to have really taken hold. It's, and again, we can maybe talk at another time about what it is about these actual variants that has them be so robust. What it is about how they mutated or changed that makes it that they're easier to spread and transmit. There's some science behind them, right? Like some of them bind to additional receptors. Some hang around in your nose and your throat longer where it can grow and proliferate. So the short version is I don't have the answer, but I'm staying on top of it. And the one that I'm hearing the most about now is mu, not Lambda.
Did that help you, Paula?
Just one really quick line. Paula, just one thing. The Hong Kong flu from the 60s became untraceable as of 2017. So regardless of the actual variant itself, just know that COVID gonna be with us for some time now.
Wow.
Yeah. Mm-hmm.
Okay.
Thank you for that.
Okay, but that's why we need infection prevention specialists, infection preventionists like Dr. Deb. That's why we need epidemiologists like Dr. Shanina Knighton and epidemiologists like Dr. Deborah Verholden. We need people to explain these health issues to us. We need people to explain that because there's some questions you need to be asking within a vaccine. You need to be informed. If you want to be grown, which means you got to take responsibility. You've got to take the reins of your health care. There's some things that you should know. You should be curious. You cannot be an incurious patient. That is not safe. I'm sending you all much love. I got to move on to this next time. Dr. Shanina Knight, and I think we need to expand this conversation. What do you think?
Absolutely.
Yeah.
Okay. Well, shoot me a text or something about what we're going to go over tomorrow. I love you all. I need to get these lines. I love you, love you, love you. Thank you, Paula, for calling in. I can't believe Paula called in. Paula talks high trash online. That's my girl. I love her. Love her. Okay, so you can have those two lines.
Yeah, I have all the next 4 guests on, sending them through right now.
Put those lines that we just had with Dr. Deb. Can you move 2 of those guests down so we can free up call-ins?
Yeah, I can. Yeah, for sure, I can make that happen.
Thank you. CK, are you feeling okay?
I'm feeling better. I don't sound so good, but I'm feeling better.
60 seconds.
If you want, you don't have to do this.
Right. I mean, do I sound sick to you all?
No, it's okay. You've been running between Kansas and Atlanta and every place else. It's just a lot.
No, it is.
You are now a football mom.
I think I'm just. I am. I think I am. It's not COVID. That's always a good thing. But I am, just sort of the big, probably just a little. My body. I don't think my body's run down. It's just that I probably around this time, allergies, like the beginning of a cold, and so I just wanted to knock it out. I'm like,
well, you know what? I got this. Spray that's supposed to really help a lot, and it does. I'm using everything.
Actually, no, it's not.
I'm using everything now. Stand by, everybody.
Change the world, change the world. We can change the world, we can change the world, change the world.
This is the Santita Jackson Show.
War and hate to a place of love, it's not too late. Gotta save the children, we can't wait. Let's change the world.
Hey, everybody, welcome to the Santita Jackson Show, WCPT 820, the nation's largest progressive talk radio station, AM 950 radio, the voice of progressive Minnesota. I'm Santita Jackson. This is the Santita Jackson Show. It's great to be with you today. We've been talking about vaccine mandates, and not just the mandates, the calls for the unvaccinated not to be treated. What do you think about that? Do they deserve health care or not? I want you to go to the podcast of this show so you can hear the stirring conversation with Dr. Deborah Holden, brilliant epidemiologist, Associate Dean of Public Health at Michigan State University, and Dr. Shanina Knighton, research scholar from Case Western Reserve University, infection preventionist and registered nurse. WCPT820.com/Santita is how you will hear that podcast. Everybody, let's talk about this class action lawsuit about stop and frisk in Chicago. 2 million people in this class action lawsuit are suing the city of Chicago and the Chicago Police Department. How will that work? More of that in just a few minutes. Let's get a few of the headlines out the way. Chicago, we will have a high of 81 degrees, partly cloudy. Minneapolis, St. Paul, a high of 76 degrees, scattered showers. The Twins will be playing the Yankees today, and, well, the Cubs fell to the Giants. The Giants 6, Cubs 5. But the White Sox were triumphant over the Red Sox, 2-1. And now football season is here. But in Chicago, boy, we had a tough time. The Rams 34, the Bears 14. Better luck next week, everybody. And the Vikings, well, it was kind of tight too. The Bengals 27, the Vikings 24. Everybody. Tropical storm Nicholas takes aim this week at Texas and Louisiana. They're having a tough time in the Gulf region. Sending our love and prayers to all our brothers and sisters down there. Not only will it dump a lot of rain, it could also strengthen significantly in the coming days. Let's hope that it does not. Reactions are continuing to roll in after President Biden announced new COVID-19 vaccine mandates last week for federal workers, large employers, and healthcare staff. Consumer Brands Association, a trade group that represents big brands like Coca-Cola and Kellogg and Campbell Soup, issued a letter today with questions about the plan, like how to ensure proof of vaccination. Arkansas Governor Asa Hutchinson said he's worried that the new mandates will harden resistance rather than convince people to get the shot. What do you think, everybody? Continue to weigh in with my morning stars on the Santita Jackson and Friends page. Everybody like and share, like and share, like and share. The spending bill. House Democrats are expected to release a draft proposal of their $3.5 trillion budget package today, and Dems are looking to raise taxes for the country's richest and corporations to pay for it, $400,000 a year. If you make less than that, you won't be touched by it. If you have a business with an income under $5 million, you won't be touched by it. The California recall is tomorrow. We will see how that will work out. Will Gavin Newsom hold on to his seat, the Democrat, or will Larry Elder, conservative firebrand, and indeed, he would be the first black governor, Will he be able to win? We will see, everybody. So let's get right to it, everybody. Let's talk about this class action lawsuit. This class action lawsuit filed on behalf of Chicagoans. 2 million say they were stopped and frisked without cause by Chicago police. And now the lawsuit is on. There's a federal court that ruled that the Chicago Police Department unconstitutionally conducted a stop and frisk policy that affected more than 2 million, mostly Black and Hispanic men, and that the scope of this practice is staggering, everybody. The percentage of Black stop and frisk was greater than was greatest in 2010. In 2010, there were 335,000 stop and frisks. In 2011, 380,000. Fell in 2013, 317,000. But it also rose again in 2014 to 713,000, and on and on and on it goes. In 2010, Blacks represented 63% of the stops. In 2010, in 2011, 65%. In 2012, 67%. In 2014, 68%. 71.9% in 2015, 71% in 2016, and on and on and on it has gone. And I want to know what you think about this, everybody. 2 million people. What will that look like? It was so many. It happened so frequently. For so long. What do you think about this, everybody? We've seen a Rainbow Push. Our coalition is involved in this, but we have seen this led by Reverend Paul Jakes and many ministers who have been very, very concerned about their constituents. They said, what is going on? And now it's been codified. And so I want to know what you think. What about 2 million Chicagoans, mostly Black and brown men who have had to suffer through these stops and frisks? I want to know what you're thinking, everybody. And then we're looking at this young Black woman who was walking her dog on the lakefront. And what happened to her? Nikita Brown, she said that if the police officer on the floor, I would be dead. Wow. He was aggressively grabbing her, walking her dog on the lakefront. And it just goes on and on and on. It's not just for men, everybody. It happens to women too, Black women too. So let's talk about it. And brown women. I mean, so what's going on? We've got a tremendous panel who are going to help us to really. You've got T.O. Hardeman, my dear friend, who has been working on this particular on these cases for years. T.O. Hardeman, Executive Director of Violence Interrupters. We've got Attorney C.K. Hoffler, Chair of Rainbow Push and past President of the National Bar Association. Attorney Robert Patillo, the Director, Southeastern Regional Director of Rainbow Push, host of his own radio show on WAOK, as is Attorney C.K. Hoffler. She'll be on the air tomorrow at 10 o'clock Central Standard Time on WAOK. Robert Patillo is on for 3 hours every Sunday, starting at 1 o'clock from 1 to 4 Eastern Standard Time. That's 12 to 3 Central Standard Time, everybody, on WAOK. Attorney Mark Fancher, National Conference of Black Lawyers. He is also the author of a new book. Can't wait to have him come on to talk about it. The Negroes of Friends Village. It sounds like it's going to be absolutely fascinating. Let me start with you, T.O. Hardeman. What about this class action lawsuit? 2 million people? How's that going to work?
Well, it's an honor to see that there's a class action lawsuit being filed that represents 2 million people, because we all know that stop and frisk is unconstitutional. And then if you look at 71% of the stop and frisk, cases, those stops took place in the African American community. Now, Cook County is the #1 county for wrongful conviction. So with stop and frisk, there's always a chance or a risk that an African American person is going to be violated in some kind of way, because police brutality, excessive force cases, I mean, they are off the charts in Chicago, throughout the years. That's why the city has lost so much money paying lawsuits based on some of the actions of some of the police officials here, police officers. So stop and frisk, what I'm seeing now, I applaud
Reverend Jakes and some of the pastors that have stepped up to the plate based on the fact that somebody has to speak up for the voiceless people here in Chicago. You know, stop and frisk took place around the Rahm Emanuel administration. And, you know, the former superintendent, Gary McCarthy, he's from the East Coast, New Jersey, New York, and that's a policy they use there. But there's no evidence that stop and frisk has helped to reduce gun violence in Chicago. There's no evidence anywhere, no empirical evidence. So what I feel about it is basically it's time. It's about time to address this elephant in the front room, which is stop and frisk, Santita. And then I hope that everything works out okay in court. But even if the ACLU compromised with the stop and frisk policy some years ago, they reached a concession, like a middle ground with the city, knowing that stop and frisk was unconstitutional. So that's a problem too, because you cannot continue to. It's not good best practices to deal with politics when you're addressing issues like stop and frisk. It's just straight up wrong. It's a violation. It's like, think about apartheid, you know, back in the days, you know, some decades ago, where you had people that were born in South Africa. They needed some type of passport to go downtown and conduct business in their own country. And they would be stopped and frisked, you know, for their passport in their own country. And now there's a preponderance of evidence that dictates stop and frisk is just straight up dead wrong, unconstitutional, and 71% of the cases that take place in the black community. Once again, black people are being targeted by some of the powers that be, and some politicians just overlook this issue here, and it's just wrong. Imagine a lot of young African-American men in particular, and some of the young women who were arrested because they may not have had, driver's insurance. You know, everybody needs to have insurance, don't get me wrong, but, you know, they may not have vehicle insurance. They may have a sticker missing, or they may have whatever the case, but by you being African-American, then that causes the police to go in there and search for everything else in your car, okay? I would never take up for people that break the law. I want to make that clear. But stop and frisk, it's visible that a lot of people that were stopped and frisked, they were not breaking any laws. So why harass the people, period? So those are my initial thoughts.
No, I mean, those are legitimate thoughts indeed. Anthony Romanucci, who's the lead attorney on this case, broke it down this way. He said 2 million stops represented nearly 2,000 per day, 1.3 every minute without cause, 24 hours a day, 7 days a week, 365 days a year, 2,000 per day. And we know that when I think about this gentleman who followed George Floyd, when he saw him being pulled out the car, stopped and frisked. He followed him, and they asked, an older black gentleman, they asked him, his name escapes me at the moment, they asked him, why did he do it? He said, just being nosy. No. He knew that when he saw those police officers pulling that man out the car, that black man out the car, that this might not end well. And that's what happens. Let me just go around to the rest of the panel and ask them what they think. Robert Patillo, your thoughts?
Well, you know, it's interesting to me because the only people who seem to support stop and frisk are the people who are not at risk of ever getting stopped or frisked. Imagine if you change the dynamics some. Imagine a group of young white co-eds walking down Magnificent Mile, just going and shopping and going about their normal day. Some Chicago police officers pull up, grab them, throw them on the hood of the police car, put an elbow or a chin in the back of their neck, search their pockets, go through their bags, find out what they're doing, not on any probable cause, not because they've done any criminal activity, but just to see what they're up to. Then afterwards, they just throw them back on the street and drive off like nothing happened. Imagine the news that will make in Chicago. Imagine the news that will make nationally if that happened. That happened to me on more than one occasion in Chicago, and there is no recourse. That happens to black men in Chicago on a daily basis and around the country with no recourse. So the only reason that people support these ideas and say they ameliorate crime is because they're not at risk of actually being victimized by it. And they believe that these individuals, just because of the color of their skin, because of their social economic standing, because of their neighborhood or their zip code, do not deserve the exact same human rights as any other group. And it has to be stopped by legislation and by litigation, because often public officials are afraid to act on anything which the public sees as being soft on crime, quote unquote. So these these things have to happen, and we have to understand that these are shortcuts that cities and states take in order to make it, in order to avoid having to solve the social economic problems that exist within their community. And they do it by shorthand, by simply discriminating against certain groups. And I think that if they want to have it, put some equity into it. So you have to keep statistics on everybody that you stop and frisk, and make sure that you're doing it in every community, in every zip code, and every neighborhood the same. And I guarantee the outcry would change it within days. But in lieu of that, we have to ensure that we have litigation of this nature that will stop it from happening.
C.K. Hoffler, Attorney Hoffler, 2 million people, how would that work in the court system?
Well, when you have, first of all, good morning, Santita, and to your other guests as well. When you have class action such as this, and you have a class that's been certified, federal class action, it's not so unusual. It's not that you have every single person that is bringing an individual case in the system. So this is not clogging up the system as well. It's really just one case that where you've got named plaintiffs that are bringing this case on behalf of a class of roughly 2 million people. So it's really not, it's just like any other lawsuit. Class action lawsuits, which I've done and been a part of, are more complicated than individual cases. But once a class has been certified, either under state law or federal law, and in this case, federal law, it proceeds throughout the court system like other cases. So it's not necessarily more onerous. The proof and the evidence that you have to submit can be onerous, but that is what is done prior to filing lawsuit. And Antonio Ramanucci, he has worked on a lot of civil rights cases. He's very familiar with these types of cases and has done them a lot. So I think it's about time that this has been challenged. This is not a new phenomenon. And I would just add a little bit or broaden a little bit what Robert Patillo said. It's not just about Black men and women being stopped based on their zip code or based on where they live being disadvantaged. These are Black men that are being stopped no matter who they are, no matter where they live. I recall in the 1980s in the D.C. metropolitan area, this was a very, very significant issue as well. Law students, some of my fellow law students who are Black men, they would not, especially in Prince George's County, Maryland, ironically, they would not drive. If we had parties or events to go to, the women would drive because the Black men were being stopped and frisked all of the time, whether they were walking or whether they were driving. So this is not a new phenomenon. These are unconstitutional violations, meaning violations of the U.S. Constitution, the Fourth Amendment, which pretty much guarantees, if never implemented, to all citizens to be free from unlawful searches and seizures. That's where this starts. So in Chicago, which has had the worst history, the worst track record, this lawsuit is timely. I'm glad that it is coming, and hopefully we'll be able to change law or bring about some meaningful change in Illinois and in Chicago in particular.
Attorney Mark Fancher, your take on this. I mean, the author of the book, The Negroes of Friends Village. Can't wait to have you on to talk about that. I know it's exciting. National Conference of Black Lawyers, brilliant columnist and really thinker, lawyer. Civil libertarian, your thoughts about this class action lawsuit? I guess I was just stunned by the 2 million, in a class action lawsuit. What are your thoughts about this?
Well, I think Attorney Hoffler explained very well that the class action device is designed to efficiently handle the claims of many, many people. So when you see a figure, like 2 million or something like that, you think, how in the world are they going to do it? But it's designed that way so that you have class representatives, people who step forward, and you may have only, half a dozen, however many. But the court has looked at these individuals and looked at the allegations that are made in the complaint and decided that this is appropriately handled as a class action. They look at 4 things in particular. They want to look first at whether there's so many people who have claims that a class action would be appropriate. They look at whether all of these people have questions of law and fact in their cases which are common, that they're the same basic claims that they're asserting. They look at whether the claims of the representatives who are stepping forward to represent all of these people are typical of everybody in the class as it has been defined. And finally, they look at whether these representatives, plaintiffs, and their attorneys are going to adequately represent the interests of all of these people. So that when all is said and done, the court is basically looking at this small group of people and saying, you know, whatever we decide for you, we're deciding for the millions of people who you represent. And it's a more efficient way of dealing with it. And it is good news because it increases the likelihood that large numbers of people are going to obtain relief. But one thing I did want to note, you know, many people presume that racial profiling is unconstitutional on its face. It actually isn't. You know, police are able to racially profile. However, they can do it only under circumstances where race is a significant factor in their efforts to try and, you know, find or locate an individual who has been demonstrated to be a criminal offender. So, for example, if there have been a series of break-ins in a neighborhood and the description of the suspect is that he's a black male who's 25 years old, about 6'3", then they're allowed to look for people who look like that. But the critical aspect or the critical element of this is that there is a crime which has been identified that's associated with this individual. And the problem with stop and frisk of the type that's being challenged here is that most times there is no crime that has been alleged. The police are just simply looking for people who happen to be black or brown, regardless of whether there's been a crime that's you know, that they reasonably suspect has been committed. And that's the standard that an officer has to use when stopping a pedestrian. They have to have some reasonable suspicion that this individual has committed a crime. In the absence of that, they can't stop them. But in many of these departments, you know, officers as on their own are just stopping people randomly who are black or brown, or in some cases, as in New York, they're specifically and explicitly instructed to stop people just because they're black and brown. And, you know, you find these numbers throughout the country, and in the case of New York, what they ultimately found is that the overwhelming majority of the people who were black and brown who were just stopped simply because of their race were not issued tickets, and they were not arrested because they had committed no crimes.
2 million stops and frisks, everybody. 2 million. 2,000 a day, 1.3 every minute, without cause, 24 hours a day, 7 days a week. And the numbers, the percentages kept climbing for black men. More than 70% of these are black men. Brown men right behind them. What is going on, everybody? What do you think about this? I want to hear your thoughts. Call me or text me at 773-763-9278, 773-763. WCPT, do you expect this lawsuit to change the behavior of the Chicago Police Department? How is this going to work? I mean, this lawsuit has been filed against the city of Chicago and the Chicago Police Department. What does that mean? What do you think about this, everybody? Whew, it's unbelievable. Call me, 773-763-9278. I want to know what your thoughts are. 2 million stops and frisks. 2,000 a day, 1.3 every minute. Wow. Back with more of the Santita Jackson Show in just a minute. Okay, we're on Facebook Live, everybody, but you all can talk amongst yourselves. Just very quickly, let me ask you, Mark, what about this book, The Negroes of Friends Village? Give us a quick synopsis. I have about a minute.
Oh, sure. No, it's set in 1967 and 1968 in an imaginary tiny town in North Carolina that was founded by Quakers back in the 1820s and which served as a stop on the Underground Railroad. And so because of that, the race relations in that town, unlike all of the surrounding cities and towns in that area, the race relations have been excellent. But there comes a time when a cross is burned on a black family's farm, and it creates all kinds of confusion within that town. The Klan comes, Black Power militants come, And all of a sudden, these, townspeople who have gotten along so well are faced with all kinds of issues they've never had to deal with before. So it's really the story of how they navigate through it. But many of the characters are people that are based on people I observed growing up in the black community in Nashville, Tennessee, and situations and circumstances and really strange kinds of things that people used to say and do back in the late 1960s that'll make people laugh, I think, or at least be amused at some of the things that we used to say and do. But you should email me your address where I can send you a promo copy. I do need to do that.
Oh, because I want you to come on and talk about it more extensively. And I know Robert will have you on his show, as will CK. Ooh, so we can get the word. We got to promote books like this, and we're the ones who have to do it.
Yeah, I've got to get you on tomorrow morning. I'm doing the morning show, so this is going to be a great topic.
I love it. I'll send it right away. Okay, Mark, if you don't mind, I'm going to send him your number. Okay.
Sure.
Okay. Well, hold on a second.
Santita is literally the best booking agent on earth.
Oh, I know. I mean, nobody has to even say that. You can just sort of see it.
Well, you want, but you know what? I need everyone. When you all come on the show, do me a favor. Put me on your social media, okay? Please let people know that you're going to be on the air. That would help a lot.
Will do.
Please do that. Please, because the show's really been growing, and I want to continue to help it to grow. And so let's do that.
Yeah.
And Robert, if we could talk later on this afternoon, if you have any time, please give me a call or let me know when I can call you. So everybody, but please let me just look. I'm just going to connect you all by text, okay? Okay.
And I'll share the video, Santita, within my network, okay?
I just love you, T.O., even though he loves my brothers better. But that's all right.
No.
I'm going to leave that alone.
You the queen.
No. He's like, Jesse and Johnny, they're my boys. I'm like, oh, okay.
Yeah, Jonathan, one of my good friends. That's all. Jonathan, real cool.
Jonathan loves you to pieces.
60 seconds.
He said, that's my boy. That's my boy.
Good brother, that's right.
That's my boy. Let me see.
Yeah.
Okay, Mark Fancher. Okay. It's going to look a little crazy. Half of it's text and half of it is, well, I'll do it correctly. Okay.
Live. 10 seconds.
We can change the world, change the world, change the world. We can change the world, we can change the world, change the world.
This is the Santita Jackson Show.
War and hate to a place of love, it's not too late. Gotta save the children, we can't wait. Let's change the world.
Hey, everybody. Welcome back to the Santita Jackson Show. September 13th, 2021. WCPT 820, the nation's largest progressive talk radio station, AM 950 radio, the voice of progressive Minnesota. Everybody meet. Hey, Diane Gibson down there in Texas, sending you much love. Everybody, please call me at 773-763-9278, 773-763-WCPT. You can text me at that number. GWC Injury Lawyers gives you the opportunity to do that. But I also want to hear you, and I want you to join in the conversation with my morning stars on the Santita Jackson and Friends page on YouTube. on Facebook and on YouTube, the Santita Jackson Show. That's my channel. But you can also go to Reverend Jesse Jackson's page and weigh in there as well. I want to know what your thoughts are. Between 2010 and 2017, 2 million stops and frisks, 2,000 per day, 1.3 every minute, 24 hours a day, 7 days a week, 365 days a year. 70% of those stopped and frisked were Black men. What is going on, everybody? And guess what? We've always heard about New York, but it turns out the Chicagoans were stopped at a substantially higher rate than in New York in 2011, which was the peak of New York stop and frisk. So this is like a real issue, everybody, a real issue. And so we're talking with Attorney C.K. Hoffler, immediate past president of the National Bar Association, the largest and oldest Black bar association in the world. And she's the chair of Rainbow Push. And we've got attorney Mark Fancher, who's got an exciting new novel, The Negroes of Friends Village. Of course, he's with the National Conference of Black Lawyers, but we want you to pre-order the book, The Negroes of Friends Village. It seems like it's going to be quite an exciting book. And he's going to be touring on the radio because we're going to make this a bestseller. Of course, attorney attorney C.K. Hoffler, her radio show is on WAOK tomorrow, every Tuesday, from 10 to 11 Central Standard Time, 11 to 12 Eastern Standard Time. Attorney Robert Patillo is from 1 to 4 Eastern Standard Time every Sunday on WAOK. He's also the Southeastern Regional Director for Rainbow Push. And T.O. Hardiman, Violence Interrupters. We just love you, T.O., for all the work that you've done. And as you continue to press, now we're seeing a class action of this as a fruition is really your own works coming to fruition, just year after year, day after day. You keep pushing. Let me go to Jim. Jim, what's on your mind today?
Good morning, Santita. I hope your parents are doing good.
Oh, that's so sweet.
Wanted to mention,
They
I
are.
just wanted to mention Barbara, thank you. I'm glad to hear it. Barbara Lee is the only dissenting voice against the move into Afghanistan. The only cogent argument, it was a beautiful argument, it's almost like the one senator against Vietnam years ago. But the point is, the Patriot Act militarized the police. You saw the tanks in the streets when we had those peaceful protests. We've been military. The police have been militarized. I'm sure that they have more, those units that are ridiculous, machine guns, and it's just.
You know what it looks like, Robert? It looks like if you look at footage of South Africa in the 70s, in particular in the 60s, when they were the brown ships. It's kind of, it has that feel. It has that feel. And of course, it's starting in the Black and the brown communities, most profoundly in the Black community, but it's happening in the brown communities. But it's mission creep, right, Jim? We're going to see it. We're seeing it spread all over the country, right?
It's happening everywhere. I saw they overreact to the police. They're geeked up to a point where they're ready to overreact in everything. They can't discern the situation they're in. Anyway, you have a great morning, and your guests too. Thank you, Steve.
Bless you, and thank you for asking about my parents. They are doing quite well. Our mother is out of the hospital. She came out last Friday. She's getting stronger every day. Dad is now in rehabilitation for his Parkinson's, and he is getting stronger every day. And thank you for your prayers. Thank you for your warm thoughts, because really, the prayers of the righteous availeth much, and good thoughts mean a whole lot. And I want to thank you for all of your love. Thank you on behalf of our family. Thank you. Let me go to you, Robert Patillo. 2,000 stops per day, 1.3 a minute. Let's just stop right there. That is just insane.
This is the thing about the criminal industrial complex, the criminal justice or the criminal legal system, dirty little secret, which is that we invested so much in, as the caller said, military hardware for police. We invested so much into building private prisons. We had to figure out ways to fill them up. So when you're talking about these stop and frisk type activities, what they're doing is just trying to find people to fill up all these jails. They have to find people to justify the budgets they have from these police departments. Instead of simply fighting the violent crimes and dealing with the property crimes, they've criminalized existing. that if they can find any form of contraband on you, this is very much a Nazi Germany type show me your paper situation in many black communities. The fascism that many people are afraid of has been in black communities for decades now. This idea of not having your freedom and autonomy to simply go about your day and not be stopped and harassed and maybe arrested for something you have on you, or if nothing else, have your civil liberties violated simply because of who you are. So as America talks about these things in other countries, talks about the way that China is treating the Uyghurs, talks about the way what's going on in Myanmar and what is going on in Guinea and other countries around the world, we have to look at the way that we treat our own citizens and start to ameliorate many of these factors, which in the name of stopping crime, we've decided that certain people, simply put, do not deserve to be Americans. And until and unless we are able to rectify that, then we have no standing on the world stage to talk about human rights in any other nation. We have to put these into the larger context. People often forget that when Malcolm X was assassinated, part of what he was doing was taking the grievances of African Americans in this country before the United Nations to have international condemnation of the way that African Americans are treated in this country. And many people believe that that is part of what led to his assassination. So when we look at these things in context, it's not simply a black people don't like the police issue, as many in law enforcement and police unions and conservative media try to portray it. It is more so the human rights of entire groups in this country are not being respected. And America cannot justify our positioning and our standing in the world, and we do not treat our citizens with the same human rights which we demand across the globe.
Well, what about what we demand across the globe, Mark Fancher? I mean, because this is a global problem. I mean, and it's, of course, it impacts black people in the United States and black people wherever we go in European countries, but it impacts it's just vulnerable communities or communities who do not appear to have the power. This is how they're treated. But let's look at this racial problem that we have in the United States, Mark.
Yeah, I mean, I really don't make much of a distinction between military forces and, if you want to call them this, paramilitary forces, the police departments. When you get right down to it, all of them have essentially the same function, and that is to keep the undesirable people, the marginalized people, the people who might disrupt or in some way make trouble for people and forces with power under control. That's primarily their responsibility. It's not law enforcement or fighting crime. It's just to keep certain populations under control, and that is a global phenomenon. And, so much so that there has become a blending or an integration of the resources that are available to these forces. So, the reference was made by the caller to the militarization of police. Well, I mean, it's no wonder that they're militarized, because the 1033 program that the federal government has makes available to local police departments all this military hardware that they otherwise wouldn't have. High-powered rifles and tanks, rocket launchers, things. I mean, what does a local police department do with that kind of stuff? And more, threatening actually to me than the possession of the hardware or the weapons is the mentality, the mindset, because the culture of policing in too many departments is one which is better suited for soldiers who are occupying territory in a war zone, rather than people who, as their motto says, to protect and serve. And so when you've got people who believe that their mission is to go in and to occupy communities, to keep them under control by use of force, to treat them as the enemy, by interacting with them in hostile ways, and to suspect everybody who's a member of that community, then you have these kinds of things, not only the frequency of stop and frisk incidents, but also the escalation of them into very lethal, violent kinds of conflicts and confrontations.
And it can go left real fast. Between 2010 and 2017, it is estimated that there were 2 million stops and frisks in Chicago, 2,000 per day, nearly 2,000 per day, 1.3 every minute. Let me say that again. Between 2010 and 2017, there were 2 million stops and frisks without cause. 2,000 per day, 1.3 every minute, 24 hours a day, 7 days a week. 70% of them were black men. What is going on, everybody? What is going on? And what do you tell your children? Your children who are now young men, C.K. Hoffler, one of whom plays for Kansas. He's a big football player, but he'll always be a baby to me. What do you tell him? And oh my goodness.
Well, I have to tell you, Santita, what you tell them is they've got to be vigilant every step of the way. And by the way, it just popped into my mind. On my way 2 weeks ago to my younger son's football game in high school, I was stopped and I was driving, some would say, a sort of a flashy looking kind of sports utility, vehicle. And I had on my mommy attire, I was going to the football game, so I was about to cheer. And when the officer came to my window, I said, "Officer, because you have to be contrite. And I'm sorry, why was I stopped?" He said, "Well, you were kind of," and I don't even know what he said because it didn't make any sense. And I immediately said, "Well, officer, I apologize. I was very, very, very apologetic. I apologize because I need to get to the game." And I said, "And I'm an officer of the court." He said, "Oh, really?" And then we talked for 5 minutes about what I did. And he said, "Well, no worries. Just a warning, just be careful." That was the conversation. The whole time I was mindful that was not the conversation that 95% of African Americans who were stopped have. And by the way, it could have easily turned south.
Absolutely.
Easily turned south. There was literally no reason for him to stop me. And I think of my kids who were stopped. They were not frisked. They were not told to get out the car and lay on the ground. But it could have been that for them. And they were fearful that could happen. So what we have to tell our kids is don't move, put your hands on the dashboard and be very, very, very compliant so that you can live. Don't let, of course, there's a sense of injustice. Of course, there's a sense of indignation. But don't let that come out because you got to live to do something about it. And that's what we have to tell our children. It's a life or death situation.
It is. But because I'm wondering, it's like he was nice, because I'm nice to the police and all that. But, the thing is, it's like, wait a minute. I'm trying to figure out, how friendly was the warning? I mean, you were already, we've established you were in a nice car, in an upscale car. Were you in an upscale neighborhood? Was he trying to figure out what you were doing over there?
Neighborhood. I think what it was is he was like, "What is she doing in this neighborhood?"
Okay.
By the way, I live very close to, I live 3 minutes away. What is she doing in this neighborhood in this car? I had on a football jersey and I had on a hat, with the school emblem on it. And I can tell you it could have gone south because I was like, I just know, in my mind, I just know he didn't stop me. I just know I didn't get stopped. I was really annoyed, but what I did is I had to take the lessons that I teach my kids. I counted to 10 and I said, "Oh, officer, yeah, how can I help you? What was I doing wrong?" He said, "What?" And I think when he heard me speak, he was like, "Oh, well, maybe." And I gave him my license. He did. I don't know if he thought maybe I was in a stolen car. I was in the wrong neighborhood. All of those things. But I can tell you, he did not have probable cause to stop me. There was no reasonable suspicion, which is the standard. So we're talking about this class action in Illinois on behalf of 2 million people. Reasonable articulated suspicion that a crime has been committed or about to occur. Now, he didn't frisk me, but he stopped me. But that would be the standard, the legal standard for him to have frisked me. I de-escalated the situation by just my, demeanor being friendly. But I can tell you, in my head, I was having a very, very different conversation.
But you know what?
And immediately I thought about my kids because, I've been on this earth, several decades, many, many decades more than them. And so I have the ability to de-escalate because I've been a lawyer for almost 35 years. I've been trained. I've litigated. I'm a warrior. But for 99% of the people who are stopped that way, they're not trained that way. And even when I know some judges that have been stopped, put on the ground in LA, held for 2.5 hours, for doing nothing but driving a nice car. And there was somebody 50 miles away, a black man, the description was a black man who was 5'10". And sitting, I don't know how you can tell when someone's sitting in a car and driving by you that black man is 5'10". I just don't know that. But black man who was 5'10", stopped, frisked, held for 2.5 hours detained. This is in LA. So see this, and that happened over 20 years ago. This has been happening for a very, very, very long time. So again, I'm delighted to see this litigation. I'd like to see where it goes. Perhaps it can be a blueprint for eventual change. The stop and frisk violations, that's been around for a very long time. There are a lot of legal challenges. Some class actions have been attempted before, but if ever there were a community that needs the curing that a class action can bring, it is in Chicago. So I'm eager to see how this develops. I think the right dynamics are there. The legal team that's been assembled knows what they are doing. And the demographics, unfortunately, are there because there's so many, 2 million people. And those are just the people who are documented, by the way. I'm sure there are a lot more.
1.3 every minute, 2,000 per day. Yep. That is unbelievable. But Robert and Mark and Tio, she speaks so well, Robert. Yeah. Is that what this was?
Part of the issue is, and I can tell you this from experience, often you don't get a chance to speak. Often all of those protocols that are supposed to take place prior to a Terry stop never take place. Often what happens is you just find an officer grabs you, puts you on the hood of a car, and starts going through your pockets and they tell you to shut up, before you even have a chance to speak, before you have a chance to even find out what you're being stopped for, what you're being searched for, particularly when you're walking. So they don't have an opportunity to find out how articulate you are, how much you know of the law. And often we find ourselves in a situation where a little bit of knowledge can do us harm, because I've seen many cases I've had with clients where they'll say, well, I asked the officer, why am I being stopped? I asked the questions that I was told you're supposed to ask prior to being stopped. And the more I talked, the more angry the police officer became, the more enraged he became, and the more violent they became. So we have to have a complete change in police culture where they understand. Often you hear them police chatter, they talk about perp. The perp is there, the suspected perpetrator, this, that, and the other. And instead of simply saying, there's an individual that we would like to ask questions of. And once you start seeing people as individuals and human beings and not simply this amorphous, dangerous, evil being that needs to be subjugated, well, you start treating them differently. But until police culture changes, and the way that we regulate and train and recruit these individuals change, we will continue having these problems going forward. Because if you look at the case in Denver recently, with the young boy who had I forgot his name because there's so many of these shootings would take place, who said, I'm introverted, you guys are in my space.
Elijah McClain.
Those things.
Right.
Yeah, Elijah McClain. He was very articulate. He was very smart. He was trying to reason with the officers, and they shot him full of ketamine or shot him full of chemicals and killed him. So we have to look at our police culture in this country, and this is why these stops are so dangerous, because it's a life and death situation, and we should not fear our government. That is what the patriots, quote unquote, always talk about. All the MAGA crowds who wave the flag, saying that the government should fear us, we shouldn't fear our government. Well, come over to our side of the aisle and help us out over here, because we are truly in fear in many cases.
Well, I'm sure Nikita Brown feels that way here in Chicago. She was on North Avenue Beach, which is wealthy part of the city. She complied with the officers. He told her he got out of his vehicle. He followed her on foot. She was walking her dog. He said, look, the beach is closed. And told her, you can go to jail. She started recording this because even if you, as a black woman, there is no protection. Sandra Bland. She said, and she started to record this, even if somebody didn't answer, at least have a voicemail and say, if you call me in the morning, you don't reach me, I'm in jail or worse. She said, I knew if he got me on the floor, I would be dead. He struggled with this young woman for 2 minutes. Now, wait a minute. He knows he's bigger than she is. He's a guy. I have literally Oh, goodness, it goes too quickly. I got a message for you, Attorney Mark Fancher. Kind of wrap this up for us.
Yeah, no, I was just going to say, so many of these officers are driven by stereotypes. I mean, for example, some years ago, driving across the Canadian border back into the States, they were giving me the third degree. They were, I had my family in the car. They were going, and so finally the guy says, "Well, where are you coming from?" I said, "Toronto." "What were you doing in Toronto?" I said, just to try and get through. I told him, "Look, I was at a bar association convention. Can you let me go?" He says, "Bar association." He says, "So what's the name of the bar that you own?"
Oh, my gosh.
Ooh. That's crazy, man.
Oh.
Yeah.
And that is, look, Santita, I even forgot that I was stopped because this is a common occurrence. This is not the first time. I don't remember how many times I've been stopped, but it certainly was the first time. And for no reason. I mean, if you're stopped as you're speeding, that's one thing, but stop for no reason. So I don't even remember, but I remember the narrative of how we've got to do better because we should not have to live in fear. I mean, there was a part of me that was afraid. I just said, let me de-escalate this. I was in my mind cussing and fussing. I really was. Cussing and fussing.
Of course you were.
Cussing and fussing. I had a dual situation going on, a conversation in my mind, but what I was really thinking is I got to survive this. And then I started thinking, I got to survive. My child's getting ready to play football. I've got to survive for my children. It became that basic. And so I don't know that some officers, they don't realize as they're walking to your car, you're saying, how do I survive this if you are black, if you are brown? How do I survive this experience?
Mm-hmm.
Because suppose that officer was having a bad day. Just looking at me could have triggered something. I could have been, oh, I see, officer of the court. See, sometimes officer of the court works, sometimes it doesn't. Officer of the court, she's going to want to try to tell me my job. It's lawyers like her. I bet she knows Ben Crump and all those people. I want to say, oh, yeah, I do. He's a friend. I'm in cases with him. But you see, the thing is that we should not have to fear for our lives when we're driving,
absolutely,
when we're walking.
When we're breathing.
That is where we are.
When we're breathing. T.O. Hardeman, this is 2 million stops and frisks. 2,000 per day, 1.3 a minute. I've got a minute for you, T.O. Hardeman. This case is all about your work here and all around the country. 1 minute, T.O.
I just want to add on.
When can we hear you on the radio, T.O.?
Oh, yeah, every Sunday from 3 to 4 p.m. on WCPT, Progressive Radio, 820 a.m. And then I just want to add quickly, Santita, on top of the 2 million stop and frisk, the lawsuit, the Department of Justice, they were in Chicago some years ago, and they conducted an investigation on the Chicago Police Department. Chicago Police was ruled as one of the most corrupt police departments in the United States, okay? So that's why we have so many problems, and then you wonder why there's so much hostility with the police. In the black community. And then also on top of that, you have a situation where the Chicago consent decree, the people that oversee that process, they have missed 70 deadlines and 70 benchmarks. So we have all kinds of issues related to policing. And I'm not anti-police. I'm against police brutality and excessive force. I want to make that clear. We are intellectual thought leaders, but at the same time, it makes you wonder about all the hostilities. And this is where it's coming from, because some people in power are making the wrong decisions when it comes down to policing in Black America.
T.O. Hardeman, again, WCPT, we can hear you when?
Every Sunday from 3 p.m. to 4 p.m. Right there on WCPT.
But he's also on another radio station on Saturdays.
Oh, yeah.
That's right. I can't mention the name, but you don't say what time?
Yeah, Sunday on WVON 1690 a.m. every Sunday morning from 6 a.m. to 7 a.m. I'm on the radio there as well.
Just before Keep Hope Alive, I might add. Just 9 every Sunday. Oh, I love you all. Attorney C.K. Hoffler, Attorney Mark Fancher, his book, The Negroes of Friends Village. Everybody pre-order it. Let's make it a bestseller. And of course, Attorney Robert Patillo, WAOK, every Sunday from 1 to 4 Eastern Standard Time. Attorney C.K. Hoffler will be on WAOK from 11 to 12 Eastern Standard Time. I'm Santita Jackson. Can't wait to be with you tomorrow, Lord willing. God bless you. Thank you, Devin Andrakis, for a great show. God bless you, everybody. Have a great, great day.
Thank you.
Thank you all. Here, you all are great. Whew. It's just so much.
Santita, you know, I just thought about it. It's not, the schedule's not regular. It's usually Fridays. But, you know, I do these court TV. I do commentary on court TV.
Would you tell somebody?
Yeah, I know. I'm getting there. You know, this is not a natural part of what I do. It's just it's a supplement, but I'm getting better. And on these cases that I do legal commentary on, I do them like in 2-hour increments. Some of the cases are live testimony, and they're all criminal cases because the civil cases, for the most part, are stayed or continued because of COVID. And when I see Black defendants, this is tragic. When I see Black defendants in these cases that I'm doing commentary, and a lot of the cases are they're white defendants, they're either underrepresented. They're looking, I don't know what kind of way, meaning when you have a client, you have to tell your client how they should appear, how they should look in court. You have to, it's not, your advice and counsel has to extend to every aspect of that trial. First and foremost, how to appear in your demeanor. And when I see immigrants, or when they're translators, they're going down, period. Because jurors are not sympathetic, are not going to wait for a translator to get in that and this and that. And a lot of times there is no story told about the lives of these Black and brown people. When you are defending, when somebody's being prosecuted or being accused, and the evidence sheer, completely circumstantial, if you don't paint a picture of who this person is, tell a story about their life, who were they prior to being accused of this heinous crime, the jury has nothing to attach to. You're not going to be, this defendant is not sympathetic. And again, most of the people in jail say that they were falsely accused. But when I do see, however, others who are being accused, I hear a lot of stories connecting the jurors to them, what they were like before, even one way or the other, they could be convicted or not. So lack of representation, underrepresentation as well, when you do have these stop and frisk and all of this kind of stuff is also an issue. That's a story for another day. But I say that because I see the other side when people are convicted or when people are in trial, and it starts with a stop and frisk. And that's a whole nother discussion about how when we are stopped and frisked and arrested and accused of something, rightfully or wrongfully, our level of representation is different. And that's where we see a number of disparities completely.
Well, and I think we've got to have the talk about even when you comply, you can still die. There's a culture.
Stop, frisk, shoot, and kill. That's what I call it. Stop, risk, shoot, and kill.
Yeah, I mean, it's too much. It's just too much. It's too much. It's too much.
Yes, indeed.
And we have to talk about that because this culture is telling your children, oh, make sure you do this, okay, and you make sure you do that, oh, okay, and you know what? It does it to no avail. To no avail.
Yeah.
I mean, it's like.
I know I was feeling at that moment, and the whole process took about 5 minutes. And that 5 minutes, what I was thinking was, I got to live. I got to do what I tell my kids to do. And just think about it. You're stopped for no reason. You're thinking about, I got to live. That's ridiculous.
And but guess what? If you don't think that way, because if you don't think that way, you are going to die. Yeah. You're increasing the chances that will happen. You better think, I got to live. And I mean, and look, I got to sit up here and smile when I don't feel like it. I got to laugh when nothing's funny. I got to dance. Jim Crow. What is that? Yeah, I'm putting it out there. I got to do it. Are you serious?
All the time.
Yeah, I mean, here I've got to negotiate with you, judge and jury, to be God over my life. Oh no, that's got to stop. I don't need to negotiate with you. I pay you. Are you crazy? 2,000. I wanted to make 1.3 a minute. Come on.
Yeah, totally unacceptable. Totally. So, all right, Santita. So I'll be talking to you soon. Okay.
And again, how can people hear you on WCPT and WVON?
every Sunday evening from 3 p.m. early evening, 3 p.m. to 4 p.m. on WCPT 820 AM Progressive Radio, and every Sunday morning from 6 a.m. to 7 a.m. on WBON 1690 AM.
Get your people to make a poster and send it to me, and I'll post it in my social media, okay?
I'll make that happen, Santita.
Do
I'll
that.
make it happen a little later today.
Yeah, do
Yes,
that,
indeed.
please. Do that. Do that. So I can just say, hey,
Okay.
he's on, blah, 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 because you should do more of this show so the people you can get, increase your audience on that show.
Just let me know whatever you need from me. We're good. I look forward to partnering with you.
If you see a story and you say, hey, it's something I'd like to talk about, even if I can't talk about it, if I bring you on for a couple of minutes and say, hey, he's going to be talking about it this weekend, I can do that too.
We can do that. So that's what I'll do. I'll send you a text if I see a story that we need to take on a little bit. All right? I'll
just do that. Because just know I want to be supportive.
Well, you got this topic now. The mayor wants to file lawsuits against gang members to help reduce violence in Chicago. Take their assets away from them. There are pros and cons to that particular story.
Oh, send me that.
Put on your mind.
Send me that.
Okay, let me look it up. I'll send it to you. Okay.
Oh yeah. Do that today. Okay.
Very interesting.
Yeah. Send that right away.
I'll send it to you in a few minutes as soon as I get off the phone with you.
Okay. That's great.
Oh yeah.
That is really, now that's interesting. Looking at the legal ramifications of the mayor of the city of Chicago suing gang members.
Right.
Now that is interesting. I've not heard of that kind of lawsuit. I'd like to research and see, what other lawsuits out there, what precedent there is. Because that is really interesting. I suppose the concept is gang members have money. And these are civil suits. These are not criminal. Because if the mayor is suing, this is a civil suit. If the mayor's being priced, this is not this is a civil suit. It's a civil lawsuit. Now that's very interesting.
Yeah.
I'd like to see how that's going to work. I mean, because I just think that at least historically, gang members help to keep a lid on some of the violence in our community. And that's not happening now. And there's just a lot going on. There's a lot going on. And I'd like to look into that. And what does that mean? They haven't seized any assets on Wall Street, but that's another story.
That is a whole nother story. Yeah, that is a whole nother story. Gangsters of a different type, but nonetheless potentially gangsters. But I think that that would be really, really interesting. I recall, not just in Chicago, but just really throughout the country, there was a time when grassroots organizations, community leaders engaged in dialogue with a lot of the gangs to curtail and reduce the amount of violence, drugs, and all that kind of stuff. I know that's probably not happening today, but there was a time when that was a narrative. And that was very constructive, especially like in places like LA, where, there was that kind of engagement. Santita, I think your dad also engaged in trying to bridge the gap to bring out positive dialogue. I don't know today, it just seems like we're in the wild, wild west on so many levels.
Well, because quite frankly, Tio, you got bad behavior, and I don't know if Robert and Mark are still there. A lot of these the police officers are too, so it's not like it's the good guys versus the bad guys. It's just us and them.
Bad guys.
It's just.
I just text you the story about suing the gang members. Okay, Santita?
Okay, and I'm gonna look at that, and I'll be in touch with you before the day is out. I'll send it to you, CK.
That would be great. That's some creative situation there. I'm gonna research the precedent throughout the country. See if that has happened before.
I'm gonna send this to you
successfully.
I'm gonna send this to you right now, CK. I just sent it to you.
Okay. Has the mayor contemplating suing?
Yeah, again, no, you can read the articles. There's a lot of supporting articles out there too. You can do it. Look up a few other articles there. Yeah. Right. So that's what she pushes for as a last ditch effort within her crime fighting strategy, suing for their assets and also closing down some of the gas stations on the south and west side of Chicago. You can see everything is in print right there.
I'm looking at it right now.
Okay.
Yeah. Check it out. See what you think about it. And we look at the president, like I say, what's behind it. I think they say they tried it in some counties throughout Illinois, but like mixed results from it. So right now, you don't have a lot of big gang empires. You have a lot of interpersonal conflict and a lot of cliques nowadays. So suing a gang member that has nothing, and that's why they're out there shooting and robbing people. I think it's like it's the wrong type of thinking, in my opinion. But if we can back it up with science or some data, that'll be different. So we have to take a look at it, the bigger picture, what that's all about.
Well, sometimes the science and the data is what you already know on the streets. I don't need the University of Chicago to step in.
I know that, right?
I don't need them to tell me that. I already know what I see.
That's right.
Okay.
That's right.
I know what I live. I get it. So, I mean, that's lovely.
Yes. You understand?
Yeah, I really do.
Now, if this is going to be akin to what they did with Al Capone, we're suing for, damages and suing, income tax evasion, all that. If that's why you had the RICO law. See, that's the RICO law right there. I hear what you're saying, but this is totally different here. Yeah. Yes, this is different. Very interesting, Santita. I'll analyze it and get back to you on it.
Please do, because I think that's a great,
interesting commentary.
Yeah. And I think it's great. It's great to do, and it would be a great topic to cover.
Mm-hmm. I agree, and I agree. I like it because it's different, it's cagey, and it could be crazy, not crazy, but it's a different approach. But I think mayors are at wit's end of how to curb the violence and looking at different ways of I'm not justifying it one way or the other. I'm saying I believe that's the impetus behind it, attacking on all fronts. But I think attacking the street gang, I think just as with Wall Street, you need to attack. You have to cut off the head of the snake.
And I'm hoping that she's getting the best advice, because the thing is, you have to know what you know and know what you don't know, because there is a law of the streets, right? And if that's not where you're from, you don't know it, and and that's just all there is to it. And hey, she's a former federal prosecutor, so I mean, you don't know what people know and don't know, so there's that. I just know that functionally, that's something I've learned from our father. Like, no, honey, yeah, that's nice, because my father would say, if it ain't in a book, my poor baby doesn't understand it. That's me, because I'm always like point A, point B, da da da. He said, yeah, but that is not the way life works, sweetie. Okay, practically, and
I would be interested with this. Just like you're saying, I mean, I'm point A, point B too. A lot of lawyers are, let's face it. Point A, point B. Even if they came from the street, they're still point A, point B, because their experience on the street has been so long ago.
Yeah.
But I would be interested in hearing what our grassroots organizations and community leaders feel about this.
They're
living for people who are living in circumstances where they confront this every day. And I don't know this to be the case, but if there's a narrative that the protection that's afforded for in some communities, that protection against police brutality is provided by gang members, that's a different dialogue. Do you see what I'm saying?
It's a lot of moving parts here. That's why I'm like, I'm wondering how that will work. And we need to get Teal's guidance on that. And that's why I wanted to know who's giving her advice, because it's like you need sweet advice, you need street advice. They're equally important. And since there are more people in the streets than in the suites, I think I'm going to hedge my bets with the streets.
Glad to get out here now, Santita, and I'll be talking to you. Okay.
Okay.
No, yeah, call me a little later today. Yeah, but I got to get out here now, and then we'll chat a little bit later.
Thank you, sweetie.
I'll give you a call later, Santita.
Please do. Is Mark still there?
Will do.
Well, I see his numbers. Attorney CK, girl, you sound great.
I'll hit him on both of them.
Please do. Oh, CK.
Thank you, Santita.
Oh.
Yeah.
Okay.
Thank you.
Okay.
I tell you, fighting. I always said the best way to fight a cold is to, take things that help a cold, but then rest and then get up and have fresh air.
But get the betadine nasal spray.
Nasal spray. I'm good. I'm going.
That really
I'm
helps.
out to a meeting, and I'm on the way. I'm going to stop and get that.
Definitely do that. The nasal spray is just great, and you should get you some vitamin C capsules if possible. And sending all my love to everybody before I give her this advice. I love you, love you, love you.